It's something that we all biologically go through, but for some parents and little ones, it may be a really challenging and difficult time. In today's episode of Dr. Nora, I take you through everything you need to know about teething, from what it is, when it happens, and what things you can do to help your little one and help yourself. As adults, we often don't think about where our teeth came from, how they erupted through our gums, that piercing feeling going through our gums with those sharp new teeth. It's actually really good that we don't have that memory. And in fact, children who are going through teething, this can be a really miserable time. And as somebody whose child is going through teething themselves, I think I've got some good experience to tell you how painful it actually is. And trust me when I tell you, it is pretty sore. First up, teething can happen all the way from 6 months all the way through to 33 months. Now, this doesn't all happen at once, of course. The teeth don't all just magically come up at once. Unfortunately, they come up in different stages. And in fact, different teeth come up at different times. Now, this may mean that you might have a really happy child one day, and then a few months later, they might get really cranky and miserable, and you might notice that they look like they're teething as well. And so then all routines go out the window, and you're back to square one, and you're feeling tired, and you're stressed, and you just don't know what to do. But before we get into the symptoms of teething, let's talk about when the teeth actually come up. So as we can see here from my diagram, the teeth come at different times during the child's life. So first up, your central incisors come up, which are these ones over here. And again, the second set come from about 8 to 12 months. Then come your lateral incisors from 9 to 13 months, the other lateral incisors from 10 to 16 months. The first molars come up, which happens from about 13 to 19 months. And again, the second set come from about 14 to 18 months. And then your canines come up at 16 to 22 months, and the other canines come up from 17 to 23 months. And finally, the second molars come from 23 to 31 months and 25 to 33 months. So as you can see, throughout pretty much every phase of the child's life, there'll be some teeth erupting, until eventually they have these beautiful set of 20 teeth by the time that they're 3 years of age. Now, for a tooth to come up, there are actually 3 phases that actually occur. First is the pre-eruptive tooth movement. This means that the tooth is growing underneath the gum, and it's going to start preparing to come through the gums. And you may notice that the gum may actually look red in your little one. So kind of like this picture over here. The second phase is the eruptive tooth movement. And you can kind of imagine what this sounds like. So this essentially is where the tooth root forms and the crown is starting to develop, and it starts to break through the gum. So you can see that the gum is red, but you're starting to get a little bit of a tooth appearing from the gum. And the third is the post-eruptive tooth movement. The tooth emerges and takes position. So this is where essentially the tooth comes out. Now, this whole process in itself can take up to 8 days. But if you're imagining that you've got one side coming up and then you've got the other side coming up, the duration of time may not necessarily be 8 days. It may be longer, because sometimes teeth don't come up together. For example, if you've got 2 sides, you may get one side coming up and then the other side, or you might have them both coming up together. Of course, every child is different, but certainly during these phases, it can be really, really uncomfortable for your little one. So what are the signs of teething? Well, you can see from the diagram there that sometimes teething can be quite painful. In some babies, they can be really irritable. They can be cranky. They may lose sleep at night time, and this is because everything is quiet for them. They have no more distractions, and they can really focus in on the pain of their teeth, meaning that their sleep routines might go out the window. They might lose a few naps in the daytime. They might be super cranky, super irritable, always putting hands in their mouth or trying to put in different objects in their mouth because they're really trying to get some relief of their pain. But there are some symptoms that if your child is having this, then you should perhaps see a doctor, because teething doesn't necessarily cause these symptoms. For example, teething can make your baby feel warm, but they shouldn't have a fever. Similarly, they shouldn't really have any flu-like illnesses or diarrhea. So if your child is experiencing any of these symptoms, please make sure to see your doctor to make sure that there isn't something else other than teething going on. Of course, teething doesn't have to be painful for every child, and some children are lucky and they can just breeze through teething and they may not experience any pain themselves. But for the most part of children, it can be a really difficult time. So other than those teething symptoms that your child might be experiencing, you may be able to take a quick sneaky look inside their mouth and notice that the gums are quite red. You may even see some of the crown erupting through the gum as well, and you may see that there is some changes in their mouth happening. So now that we've established what it looks like when a child is teething, what can we do to help them? Well, if you look on the internet, there's tons of advice on there. In fact, even if you go to a supermarket or a chemist, you'll find lots of products on sale to help teething. But are these products safe, and should they be advised? Well, certainly as medical practitioners, we advise very simple things to help with your child going through teething. The first of which is you can wash your hands and place a nice clean finger on the gum and rub it gently with some light pressure. This actually helps to relieve the pain for the child. So you might want to employ this, for example, if the baby's trying to sleep and they can't get to sleep because they're so irritable, you may want to do that. Other measures you could do is give them a solid teething ring. It's really important not to give them a teething ring that is filled with fluid, because if they crack that teething ring, they may get the fluid all over themselves, and that can sometimes be quite nasty. So a solid teething ring could be useful, and bonus points if you slightly chill that teething ring as well in the fridge for about 10 to 15 minutes, because having something cool on that really warm gum actually helps to relieve that pain and that soreness that the child is having. If you don't have a teething ring, then you can get a washcloth and get some water, soak it in some water, and obviously wring out the water, place it into a Ziploc bag and put it into the freezer for about 10 minutes or so, just so it's chilled. You don't want it to get frozen, you just want it to be chilled. Once it's chilled, take it outside and pop it in your baby's mouth, and that cooling sensation will help to relieve that pain. It's super important that you don't freeze the washcloth, because that can add to burning to the gums. So we don't want to do that. So really just chill it nice and chilled and place it in their gum, and that can help them to just chew it and again relieve that inflammation they've got there. Other than applying pressure or giving them something to chew on, you may want to give them another type of chew toy, for example, or even, if they're old enough, a chewing biscuit. Now, this should be done under strict supervision, of course, and examples of this could be teething rusks. So if your child is on solids, you may want to consider a suitably aged teething rusk for them, and which helps their tooth to come through the gum. Of course, please make sure that you look out for any allergens if, for example, your baby is allergic to a particular ingredient. In some situations where the above measures are not successful, you may consider using an anti-inflammatory medication on the advice of your medical doctor. Of course, this medication should be dose appropriate for your child's weight, and it can be given to relieve the symptoms of teething. If you are going for this option, then aside from getting the dosage right, make sure you use it appropriately and the correct number of times during the day. Now, I did mention earlier in my video that when you go to the chemist, you'll see lots of different products available for teething gels, perhaps some homeopathic medicines that could be available for you. But what is the stance on this, and are they actually safe? Well, interestingly enough, the FDA, or the Food and Drugs Administration, don't actually recommend using any teething gels or homeopathic medicines for babies who are going through teething. And this is purely because we don't have enough safety information about this. And it's actually been shown that in some studies, some homeopathic remedies have actually been quite harmful for a baby. Take, for example, a homeopathic remedy known as Calcarea phosphorica. Now, this is a very popular homeopathic medication that can be used for children that are going through teething or even delayed teething as well. And generally speaking, parents may choose to use this to help relieve the symptoms of teething. Now, this medication has got a number of different elements to it, and one of those elements is known as belladonna, which actually has been found to cause seizure in children. And so the FDA have released a warning to parents advising them not to use these kind of medications or any homeopathic medications, because we simply don't have enough information about how safe they are. And the feedback that is being received so far is that some children have had some harmful effects from these medications. Of course, it is a really exciting time when your little one has a tooth emerging. They'll be able to use their mouth in a different way. They'll be able to eat foods that they couldn't previously eat in a totally different manner, which is such a delight to see. It is so important, therefore, to maintain good oral hygiene for your baby. Even if they've only got one or two teeth out, it's still really important to care for their teeth. Now, this could be as simple as getting an infant's toothbrush without any toothpaste until they're 2 years of age. Or if you're not able to do that, then perhaps you could use a clean, wet washcloth on their teeth, just wiping away any food debris and their tongue as well, so that there's no kind of residue of any food, reducing the risk of any tooth decay or any caries in future. Good dental hygiene is really important to introduce really early on in life. It helps to set them out for a great adult teeth in the future. And hopefully they'll have their beautiful, white, smiley teeth. Ding. Of course, with all of this excitement, it's so important as a parent to make sure that you keep yourself nice and healthy as well. Whilst it is heartbreaking to see your little one going through lots of pain, make sure you do yourself get some rest, and make sure you look after your mental well-being. Very often I see patients coming in who are just absolutely distraught because their babies are not sleeping well at night, and they themselves look really frazzled and upset and they can't get to work. But I must reiterate that if you're healthy, then your baby will be healthy as well, and you'll be able to get through this easier together. So do call on any friends or family or your spouse, for example, if you are struggling with teething. You might need them to check in on you, or if they themselves can look after your little one whilst you have a break. All of these things would be so helpful for your own mental health. So there you have it, guys. There's everything you need to know about teething, from what it is, when it happens, and what symptoms you can expect, and how you can help your little one. I'd love to hear from you guys. Let me know what you did for your little ones when they were teething. I hope you guys found this video useful, and I'll see you on the next one. Take care and stay healthy.